Hello. So it is 2:30 right now, so I think we're gonna start. Thank you very much for being here with us, and we're happy and delighted to share with you a little bit more of the examples we have worked at La Clinica and how we work around health literacy. So, first, oh, sorry, my name is Tania Ruiz, and I'm the Health Promotion Manager at La Clinica.
And I'm Manuel Díaz Ramirez. I'm the Director of Community Health Action at la Clinica del Pueblo.
Sorry, so we're gonna start just sharing with you an example of a video we used in the times of COVID. So
enjoy it.
Enjoy it.
Hoy queremos conversar acerca de los mitos más comunes alrededor de las vacunas contra el COVID-19. Acompáñanos.
Si ya me dio el COVID-19, no necesito vacunar.
Al contrario, aún los científicos están investigando acerca de la duración de la protección natural que se genera cuando uno adquiere el virus del COVID-19. Debido a esto, se recomienda que las personas se vacunen contra el COVID-19, aunque anteriormente hayan contraído el virus. Si contrajiste COVID-19 hace más de 90 días y no te has vacunado, es recomendable vacunarte en cuanto te sea posible. Si tu infección ocurrió durante los últimos 90 días, puedes vacunarte una vez te hayas recuperado completamente.
Las vacunas se desarrollaron muy rápido, no deben ser tan seguras.
Al contrario, las vacunas contra el COVID-19 se desarrollaron rápidamente en comparación con vacunas anteriores, porque científicos, médicos y agencias gubernamentales de todo el mundo invirtieron enormes recursos para acelerar el proceso y publicar los resultados tan pronto como fuera posible. Recordemos que millones de personas en nuestra área y en el mundo ya se han vacunado contra el COVID-19 y les va bien. Estas vacunas han sido sometidas a un riguroso monitoreo científico y de seguridad. En otras palabras, las vacunas contra el COVID-19 son seguras.
Una vez que reciba la vacuna contra el COVID-19, está protegido de la autoridad.
Aún no se sabe cuánto tiempo durará la protección de una vacuna contra el COVID-19 y si será necesario administrarla más veces que las dosis iniciales o incluso si será necesario hacerlo de forma regular, como en el caso de la vacuna contra la gripe o el COVID.
¿Puedo contraer COVID-19 por la vacuna?
La vacuna contra el COVID-19 no aumenta la de adquirir el virus. Ninguna de las vacunas aprobadas contra el COVID-19 usa el virus vivo. Las vacunas no pueden hacer que adquieras el COVID-19. Más bien, lo que hacen las vacunas es fortalecer nuestro sistema inmunológico produciendo anticuerpos, los cuales nos protegen de enfermarnos gravemente si el virus ingresa a nuestro cuerpo.
Una vez que reciban la vacuna contra COVID-19, ya no será necesario que uses mascarilla ni otras medidas de prevención.
Al contrario, aún estando vacunados, debemos continuar usando mascarillas, lavarnos las manos constantemente con agua y jabón y practicar el distanciamiento físico, especialmente en espacios cerrados y poco ventilados. Recuerda, aunque la vacuna nos brinda protección para que no nos enfermemos gravemente por COVID-19, aún existe el riesgo de adquirir el virus, de enfermarnos o transmitirlo a otra persona, especialmente si aún no está vacunado.
Ahora que conoces un poco más acerca de las vacunas contra el COVID-19, ¿qué decidiste vacunarte?
Si necesitas más información sobre este tema, ven a la Clínica del Pueblo. Estamos aquí para ayudar.
Well, thank you. So that was just an example of how at La Clinica we promote health literacy. I think Karesen was mentioning like some of the myths that were running around our community about the COVID-19 vaccine. So that video was made in response for that for that topic. So, oops. Just a brief overview of the agenda. We're going to validate the concept of health literacy and its importance. on the communities we serve. Then we're going to talk a little bit more about La Clínica's health literacy model of care. And finally, we're going to talk about best practices in the Latino community. So why do we need a health literacy model? So this is just a little, really quick activity we prepared for you guys, but if you can answer these questions. What skills are needed to understand these labels' directions, and what barriers may prevent an understanding and adherence to the labels' directions? You can share the answers. Sorry? So the questions are, what skills are needed to understand this label, and what barriers may prevent an understanding and adherence to the label's directions? So just to bring us to the point that actually having access to information is not the same as understanding the information. So every day we're bombarded with a lot of information, but that doesn't mean that we necessarily understand all the information that we have. So health literacy matters. It matters for our communities on the way they seek support, they navigate the health system, they understand nutrition labels, they understand medicine instructions, analyze risks and benefits, complete paperwork, and organize their healthcare appointments. So we can see that patients with low health literacy, these are some of the main things that have been found for people that have low health literacy. So more people in emergencies room, more people or longer stays at the hospital, less likely to follow treatment plans, and of course we have higher mortality rates. So, as I mentioned earlier in the morning, at La Clínica, what we're trying to do is trying to move from an individual health literacy approach to a more organizational health literacy approach, meaning that the responsibility is not individual. We want to move from that first arrow to the second one. So the first arrow, the first picture, what it shows is that basically, as we are right now, health literacy is made up by the people's skills and the health system's complexity. But we want to make that shift in which health literacy actually is done by the health system skills and people's complexity. So what we need to do is do that change and how we provide care to our community. So that. Any questions?
How do you define people's complexity?
It's just like every people is a world. Every person is a different. It's a world. So literally, like what defines someone's health is their history, their background, the environment, their social determinants of health. So everyone has a different complexity. But right now, as we are, is that in order for people to understand what we are saying about their health, it is more about the health system complexity instead of like focusing on the individual. So that's what we're trying to change. So I talked a little bit about this in the morning, but at La Clínica, thanks to this project, we were able to do all these steps and finalize with a universal health literacy precautions model at La Clínica. So basically what this universal health literacy precautions model is, assume that all patients may have difficulty comprehending health information. So this will be done by simplifying communication, making the office environment on the healthcare system more accessible to navigate, and supporting patients' efforts to improve their health. This model has three main domains: the spoken communication, written communication, and self-management and supportive systems. And as we have mentioned a lot today, health literacy is not just about health education material or a session. Health literacy actually is really complex, and it's composed of these three main areas. So now it's Manuel's turn.
So spoken communication. So clear spoken communication is fundamental element of universal health literacy precautions. Ensures that healthcare information is accessible and well received by patients of diverse backgrounds and literacy levels. For example, and this is some of these techniques are included in our toolkit. Teach back method, Ask Me 3, spoken communication assessment, using plain language, and other tools that may be useful to check if our patients and clients and community members are understanding the information that have been given or are being received. ¿Is this activity? ¿Quieres hacerla tú mejor?
So this is just an example of one of the tools we have within our health literacy toolkit that is plain language. And we included a list of really popular words that doctors use with patients, but there's always a way to make it plain and make it easier for our community to understand. So you can say where you are, but for example, how would you make it plain epidemic? How would you explain to someone what an epidemic is? Something that gets spread around.
Major health problem.
Major health problem. Contagious. Great. Chronic disease.
It's a recurring illness that has no cure, may have a treatment, but it doesn't go away just by taking a medicine or a vaccine. It's something that will continue to be a lingering issue.
Long term. Yeah?
A health problem that it will exist over a long time.
Exactly. Hypertension. There you go. It's not easy. It's not easy. High blood pressure. Lipids. Fat. Cholesterol, fat. Benign. Sometimes we debate, like, what's the best word for this? For example, we don't know how to say in Spanish, like, health literacy. We know it's alfabetización en salud, but it doesn't resonate.
Yeah.
So
it's not common,
either.
doesn't resonate.
Just like education.
So we debate a lot.
We have debated a lot. And actually, a good practice for those kind of words or language or wording that we want to include in some materials, go back to the community, go back to your patient population, go back to your community members and ask them, what's the meaning for you guys, of this word? Like, for example, many years ago, we produced a campaign called Se Vale, about substance use, destigmatizing, talking about substance use, mental health issues, trauma, stigma, etc. So we debated the word between ayuda, support or to help. To support, to help. Ayuda or apoyo, right? So because we weren't sure, because different countries speak different nuances of the same word, right? So we went back to the community and we, among other words and other language, other phrases, we validated that word. And it became ayuda, the one that were most common used by the target population that our programs and services are intended to serve. So we used ayuda. And Tania, in the video, said, si necesitas más ayuda, ven a la Clínica del Pueblo. So each word has to be intentional. Right? It's not because I like it. It's because it has a purpose and a meaning when we design the materials using like this example.
Yeah, and I think in our case at La Clinica, it's important to mention that even though we speak Spanish, like there is a lot of terms, like different terms from different countries, so it gets even more difficult sometimes.
We cannot use materials for each of those nuances depending on the country that our clients are coming from. So we have to use a more general one that still complies with a health literacy approach on the material. There is a question in the back.
Yes, my name is Julia, non-medical case manager in Nova Salud. I just want to add that the job that we do in community health work and health educator is completely different than the education providers and doctors. So with the community, patient visit the provider is so important. They explain to the patient in their native language, face to face, I'm going to say, not using a device, and using a plain language too. So knowing the culture is a different approach, and that's extremely important.
Thank you. Thank you. I think we believe that the information the patients receive during a 10 minutes medical appointment is crucial for them. However, there is a high percentage of our patients that do not understand the information given.
80%.
80% actually, if you responded the quiz accurately. Show whenever possible desired action. Arms for social distancing, elbow for sneezing with masks to use when it's appropriate and needed, etc.
And the last bullet point is just a resource where you can actually type the word that you want to switch to plain language, and it gives you options.
Yeah. ChatGPT can also do that.
ChatGPT can also help a lot.
So written communication, right? And this is something that we have enhanced in the understanding health literacy approach is understanding the difference between different formats of communication. So written communication in healthcare refers to a wide range of written or printed materials to convey information, instructions, and messages related to providing healthcare-related topics. So some examples are there. Prescriptions, as we saw in the previous example, informed consent forms, discharge summaries, education materials, example of resources, the flesh kinky level.
Oh, that's the resources for the written communication.
Need to know versus good to know, right? Maybe, it was nice for them to know, but do they need to know for this purpose or not, right? Checklist. Also, there are other written, I'm not sure if it's next, but there are also written information that is placed in our facilities. Signage, for example. Tanya mentioned during her presentation in the morning. Signage, we take it for granted or not paying that much attention, but many of those signs in our sites have information that our patients need to successfully have a medical visit or just a visit in our facility. So signs have to be clear as well, have to be concise, have to use the same principles to when they are designed, before they are placed in our facility. So they can guide not only the access to the facility itself and the services, but also there are some information, like for example, patients' rights, right? We place it because it's mandatory, it's by bylaw, we have to place a chart of their rights as patients, but can we still do it from a health literacy perspective, how we make them better so they can understand what are their rights and take action based on those rights? So if there is room, then we can apply some of these health literacy principles. Need to know guidelines?
Yeah. This is a tool we included in the toolbox about written communication, and this is what Manuel was mentioning, the need to know versus good to know. So the need to know versus good to know guidelines is basically sometimes we want to provide a lot of information and dump a lot of information to our clients, but most of the time is half of it's not necessary. So for us, it's really important to provide the need to know information. So how do we do that? We need to limit to 3 messages. We try to always be clear and focused about the messages, take out the necessary words and information, and make sure there is a call to action that it's doable and clear. So for all our educational materials, we always include a call to action, so it's clear what we want or we would like our community members to do or access.
And also,
Okay.
yeah.
Dale.
Something that I was thinking regarding the previous slide is that the materials in any format, brochures, flyers, posters, video, any material, the material itself doesn't replace the conversation that you are going to have with your patients and clients and participants. Doesn't replace it. So that's why it doesn't have to have all the information that you may want to find good for them to know, right? That's why it has to be the necessary information for that format. The extra information, the other information that you find important for them to know, you may be able to still share with them during a one-to-one conversation, on a group conversation with them. So doesn't need to be everything in that material. However, you may see that, oh, this is a lot of information, but there is all information that this material helped clients, or we were able to provide to clients in other formats. Like these were produced at the beginning of the pandemic, right?
Yeah.
Before this initiative, the health literacy.
So this is just an example of good to know versus nice to know material. We try to provide like three main messages. Like, okay, the vaccines are safe, they protect us, and they are an act of solidarity. Those are the three. We have a call to action that is by getting vaccinated, we promote healthier communities. All the material we create, it's in English and Spanish. So we make sure that in the same paper you have both languages. So this is one of the examples of how we work with health literacy at La Clínica. I don't think we have time for the activity. We have 3 minutes, so no.
No questions.
And the third domain from the universal health literacy approach is self-management and supportive systems. And as we know, health is determined by many factors, not necessarily just health. So what we do at La Clínica that is really similar to the LinkU portal is that we have a community resources hub that actually it gets updated periodically. And what we do is that we train our staff to use this hub, and the hub has resources from food access to legal help to housing to many of the areas that we know that
Food
impact
resources.
that impact our community's health. And this is a curated like hub because most of the clinics or resources that are part of the hub, we have a relationship with those organizations. So that's why we try to do and maintain and update regularly this hub. And this helps a lot in referrals, in navigations, etc. And just to finalize, we'll have a role to play. Health literacy is not just educational material, it's your health, it's healthcare information, health decisions, making decisions together, taking health action, and feeling good about you and your health. So, thank you.